Hello and welcome to the 9th edition of UNews Weekly, coming to you from the UN Information Office in Uzbekistan in collaboration with all 9 agencies of the United Nations working in the country.
Today we're happy to inform you about the most important UN news of the outgoing week.
I'm Bobur Komilov.
And Laila Fatah.
Welcome to the show. Coming in this program, Earth Hour is a unique opportunity for individuals, groups, businesses and governments to do something positive for the environment. It symbolises the first step in the direction of adopting environment-friendly activities into everyday life, which will lead the way towards a cleaner environment and a sustainable lifestyle.
Earth Hour reached 370 cities and towns in more than 35 countries across 18 time zones.
Millennium Promise is the leading international non-profit organization solely committed to accelerating the achievement of the Millennium Development Goals and the eradication of extreme poverty, hunger, and preventable disease. UN Secretary General Ban Ki-moon gave a message titled as 1,000 Days to Keep the Millennium Promise. UNDP Social Innovation and Volunteerism Project and the United Nations Volunteers held a workshop which focused on 2 topics: how to generate innovative ideas and how to put them into practice. They also carried out several trainings and debates in Westminster International University in Tashkent to encourage youth to be active and post freely.
Basically, the social innovation concept is completely new for Uzbekistan, if not to mention this several initiatives.
World Health Day is celebrated on the 7th of April to mark the anniversary of the founding of World Health Organization in 1948. Each year, a theme is selected for World Health Day that highlights a priority area of public health concern in the world. The theme for 2013 is high blood pressure. We'll discuss this topic with Dr. Asmus Hammerich, WHO's representative to Uzbekistan, in the special guest section of our program.
The World Health Day is, of course, commemorating the birthday of the World Health Organization.
Earth Hour is a worldwide event organized by the Worldwide Fund for Nature and held towards the end of March annually to encourage households and businesses to turn off their non-essential lights for the duration of 1 hour. And here is this special video prepared on this occasion.
Earth Hour was launched in Sydney, Australia in 2007, where more than 2 million individuals and 2,000 businesses turned their lights off for 1 hour. Just a year later, Earth Hour reached 370 cities and towns in more than 35 countries across 18 time zones, and the campaign shifted from a Sydney event to a global sustainability movement. Since then, every year Earth Hour sets new standards and breaks its own records of mass participation and support. Earth Hour continues to be a global call to action to every individual, every business and every community. A call to stand up, to show leadership and be responsible for your future. At 8:30 p.m. on 23rd of March 2013, the world came together once again to switch off for an hour. The speed and scale of climate change, fueled by an ever-increasing consumption pattern of the Earth's resources, is impacting individuals all over the world. Unless we make efforts to transform our energy production systems to 100% renewable, we may do irreversible damage to our planet. Each one of us has the power to make this transition possible by taking small yet significant steps. Each one of us has the power to change the world we live in. We took our first step.
At Millennium Promise, the people's vision is the eradication of extreme poverty, hunger, and preventable disease within our lifetime. With a team of nearly 1,000 employees across Africa, Millennium Promise is based in New York with regional offices in Kenya. Let's listen to the message from Ban Ki-moon, UN Secretary General, about 1,000 days forward into our future.
Next in our program, United Nations Development Programme and UN volunteers were the first to support sustainable development in social innovation in Uzbekistan and brought it to an entirely new level. And this was done in the belief that creative men and women have their knowledge on how to overcome the common challenges in everyday life. And here is an interview with Bakhrom Radjabov, who's the trainings, PR and outreach specialist of the Social Innovation and Volunteerism in Uzbekistan project carried out by United Nations Development Programme in cooperation with United Nations volunteers.
So some time ago, the project, the UNDP project, Social Innovation and Volunteerism in Uzbekistan, has launched the first social innovation workshop under the Social Innovation Lab initiative. We are supporting together with Westminster International University in Tashkent. And a couple of days ago, the academics from Vienna University of Economics and Business gave their presentations and conducted their 2 days workshop here in Tashkent for the prospective social innovators and volunteers willing to become social entrepreneurs and to know more and to have an expertise in social innovation and social entrepreneurship. Basically, the social innovation concept is completely new for Uzbekistan, if not to mention this several initiatives in the countries of Central Asia and Eastern Europe. For instance, the social innovation center in Armenia and social innovation camp in Kazakhstan. The Uzbekistan launched this initiative for the first time. To be clear, this workshop was more or less oriented at the giving the understanding, the clear understanding what social innovation is and how to, really train the muscles of being social innovator. And during the 2 days, the participants from the regions of Uzbekistan and from Tashkent had an opportunity to obtain theoretical skills and practical skills through the exercises, as well as have the opportunity to present their projects they have developed during the 2 days of the workshop in front of the board of jury of the investors, so-called investors, people with a business mind who already had the successful experience in launching the business, also with a focus on social issues and the social impact. And in 2 days tournament, also on debate skills, the goal of the training and tournament was to share the knowledge of effective communication, of effective and really convincing debating, and defending, as well as really expressing clearly the point of view the person has. And not to mention the importance of debates and discussions techniques. This training is the first step, is the first tree we're planting, as well as the social innovation tree we are planting. Obtaining these effective debate skills and techniques so that they can use them in their academic life, in their everyday life. And we really plan to rely on both participants of social innovation training and debate training in our future activities in order to promote through the social innovation and volunteerism project the debates and social innovation mini projects countrywide in Uzbekistan.
Every year, World Health Day is celebrated around the world on the 7th of April to bring the global attention to a common public health issue. This year, on this occasion, World Health Organization, together with its global partners, are turning the attention to the issue of high blood pressure. Although the issue affects 1 in every 3 adults, it still remains largely hidden.
Many people don't know that they have blood pressure because the symptoms remain unseen. As a result, it leads to more than 9 million deaths every year, including about half of all deaths due to heart disease and stroke.
So today, on our special guest section, we'll be speaking to Dr. Asmus Hammerich, who's the WHO representative to Uzbekistan, about the issues around World Health Day this year. So today our special guest is Dr. Asmus Hammerich, who's the director of WHO in Uzbekistan, the representative of the global organization. Welcome, Dr. Hammerich, to our studio. Thank you for joining us.
Thank you very much for having me.
Our first question is in connection with the World Health Day commemorated every year on the 7th of April. And this year, WHO is highlighting the issue of high blood pressure and hypertension. So it would make sense to start our conversation by asking you to give us, to tell us more about the risks of developing this condition and perhaps give some statistics to our listeners and viewers.
Well, thank you very much for your interest in our work and in the World Health Day. The World Health Day is, of course, commemorating the birthday of the World Health Organization. So it's celebrated every year on the 7th of April under a different health-related motto. And as you say, this year's motto is hypertension or high blood pressure. And to your question, in terms of the risk factors or the dimension of the problem that we have, I would like to state that it's a very, very important disease or condition. It affects 1 out of 3 adults worldwide, and it causes more than 9 million deaths worldwide each year. And half of these deaths are occurring in the form of heart attacks or strokes. In terms of the risk that the syndrome of high blood pressure causes, it basically not only increases your risk of developing heart attacks and strokes, but also kidney failure. And it has a multi-organ effect. It affects many different parts of the body. It can cause blindness, irregularities of the heartbeat, and heart failure. It's also worth noting that the proportion of people suffering from high blood pressure increases with age, and there's also variations in different parts of the world, and Central Asia is one of the regions where, for different reasons, we see more people suffering from high blood pressure. Mm-hmm. It's also worthwhile to note that there are important risk factors that we know of, that we can change, that lead to high blood pressure. And this year on the World Health Day, we are focusing especially on the result of a high salt intake. In other words, too salty food that, especially when it's already started at a low age in children, will or can later lead to hypertension.
It's very interesting because globally, the issue is very high on the agenda. And recently, New York Times carried an article where it mentions the statistics and gives some statistics and also says, although it affects 1 in every 3 adults, the issue still remains largely hidden. Mm-hmm. So not that many people know about it and are aware of the risks. I mean, logically, our next question is about the implementation of awareness activities in Uzbekistan.
Absolutely. It'll be great to know what WHO, what the World Health Organization is doing to fight hypertension.
Yes, thank you very much. So there's many different entry points, of course, and as the World Health Organization, we focus, of course, on preventive and promotive health measures, and together with the clinical providers around the world. So we are conducting this year also a lot of public awareness campaigns. So it's not only the one day, the 7th of April, but there will be a week on fighting hypertension the week after the 7th of April, and then in a way the whole year until the 7th of April next year will be under the focus, and the Uzbek government has already planned a lot of interesting activities. I would like to also specify a little bit the objectives of those events in the coming days and weeks. So number one, we would like to raise awareness about the issues that you mentioned, to provide information in different ways through different media, to encourage adults to check their blood pressure. And together with the authorities and health providers in this country, we will make those available. To encourage self-care to prevent high blood pressure. There's a lot of things people can do without even taking medication at the early stages, at least, of high blood pressure. And finally, also to make blood pressure measurements more affordable to all.
It's very interesting. You know, if let's imagine we are now listened by someone who doesn't have a lot of awareness about this issue, but wants to stay fit and wants to stay informed about the risks of developing that. What would a practical advice be to someone who hasn't heard about it to reduce the possibility of developing a high blood pressure to an ordinary person?
Excellent. Yeah, no, and we have now, I think, a very easy to understand and hopefully to remember list, starting with the reduction of salt intake, and that affects the salt dispenser on the meal table, but also, of course, the kind of food we are eating. I think vegetable fruit is always a safe bet, and avoiding highly processed food is obviously another way. So eating a balanced diet, which is very rich in especially fruit and vegetable, is definitely very helpful. Also to reduce the amount of alcohol intake has proven to be effective. And to taking regular physical activity, there's different recommendations. I think the latest is that 15 minutes of moderate to vigorous physical exercise every day, or 30 minutes of exercise 3 times a week can lower the blood pressure by more than 5 millimeters.
Would that include jogging?
Yeah, definitely jogging,
cycling?
Or different activities depending on preference. It's also important to mention that reducing body weight does make a difference, and of course to cutting out tobacco, and tobacco is of course a risk factor for many other diseases also.
So these simple steps can mean a strong, healthy life for a long period. It's lovely to hear your recommendations. But now can you share with our listeners and viewers World Health Organization's plans for 2013?
Thank you very much. And our 3 priority areas are very much related also to hypertension, because we now vigorously support the Ministry of Health and other partners in Uzbekistan to finalize the national strategy on fighting non-communicable diseases, which include heart disease and high blood pressure. Across the country, there's an action plan linked to that, and we will assist anybody who's interested to implement that action plan here in country. A particular focus, as I just mentioned, will be on the control of tobacco. We're very happy to note that the President of Uzbekistan has endorsed the Framework Convention for Tobacco Control last August, and that opens the gate, I think, for the country to be even more energetic in fighting the abuse of tobacco. The second priority is related to the control of communicable diseases and health security. There's many important diseases still prevalent in the country, to name tuberculosis, especially multi and extensively drug-resistant tuberculosis, but also HIV and other diseases that we help fighting here in country within the framework again of international agreements, most notably the international health regulations. Finally, our third priority this year is related to strengthening the building blocks of the health system. In other words, health financing, health planning, human resources for health, also medical products and technologies for health, and last but not least, service delivery, especially at the primary health care level.
Those are extensive plans that the World Health Organization has for Uzbekistan this year.
Yes, and all we can say is wish you good luck in implementation of those plans, and happy coming birthday to WHO.
Thank you very much. Большое спасибо to both of you.
Thank you.
Thank you.
With this, we bring the 9th episode of UNews Weekly to an end, and thanking you for your company.
For more, stay tuned to www.un.us.
And of course, on Facebook, you can always stay abreast of all the events happening in the life of United Nations by going to www.facebook.com/Unique Tashkent. For now, from me and the rest of the team, it's goodbye.